We'll call her.
Hi, students. So today we're going to learn about another unit, which is about sexual disorders and personality disorders. Now, when we talk about this particular unit, we should understand some basic terms like what is sexuality, and when we fill certain forms, whether it is government exam or any other entrance courses, we have a specific, uh, what you say, a specific question that is being asked, like what sex, whether you're male, female, transgender, or so. Now, what is this particular thing? Now, sexuality is how people experience themselves as human beings. So we might have be having different thoughts, different feelings, and our relationships with others. So how well you are able to present yourself and how well you are able to identify yourself. Now, if I'm a human, I'm a girl, I want to be dressed as a girl and want to be a woman in the main course of time or in the due course of time. Now, some who don't want to be like that, now they're getting transformed to another gender. Now, that is called as a different disorder. That is called disorder in sexuality. Okay. So, sex is a different word. Now, gender is something that we all should understand. Now, when we talk about sexual disorders, don't think that it is only about male and female. Definitely, it is for us, but only difference is when our forms, whenever we fill the form, that the word called sex, it is an act, it is a different kind of activity. Now, sexuality is a girl or a boy, whoever is having differences. Now, they don't want to be a girl, they don't want to be a boy, want to get transformed into. So that is called their sexuality. Now, what is the difference between gender and sex? So far, we have discussed. Now, gender is somebody who is trying to let us know that we are girl or boy and our cultural differences. Maybe I'm from India, so my cultural difference is different. I get dressed in different form. If I am a woman from UK, so my dressing is different. My cultural background is different. That defines our gender. Now, if you talk about the word called sex, it is a biological function which helps human to reproduce, or it helps us to carry forward our generations. And in the sex we have two main categories. We say male and female, and very recently transgender also has been added up to. Now here, if you talk about gender very specifically, it is called masculine and feminine, which we usually read in the subject called English. So masculine is something related to girlish, something related to boy or that manship or that boy, how the boys like to be, their characteristics. So that is masculine in nature and feminine in nature. Then sex remains the same regardless of time. So when an activity called sex or that drive that pulls a male or a female, that is regardless of time and culture. So whether it is a person who's having a white tone like this, western country, eastern country, everybody, every human tries to satisfy themselves by having the word called sex or that particular activity called sex for our generations to progress. Now, when we talk about gender, it defines about our roles, how well we are. Now, most of the time, we are stereotyped in our gender forms. When it comes to girl, girl has to take place or take care of home, kids. She has to reproduce. She is solely responsible, motherly role, homemaker role. So, it from the ancient times in India, that has been done. So I that is stereotyped form. Now here in gender, we well defined, even though our programs or our what you say our beliefs, or maybe we are supposed to do that, but nowadays we are surpassing that. Not only females, even males share their extension or their duty. They lend a hand in helping us. So that is beyond the gender that they try to convince us or they try to move with us. Now, sex, as we've discussed, it is about recreation. producing the biological form of our very own genes, transforming them into another offspring. Now, gender is created by social norms. Wherever we are Hindu culture, we are Christian, we are Muslim or Sikh. So, our social norms. Now, to identify an individual, Sikhs wear turban around their head. So, depending up that is called pagdi. Depending upon that, you will know that he is a Sikh male. Now, females, they don't cut their hair. Some females drone dupatta around their head. They don't show their hair. So it depends. So gender is something which we create according to our culture, according to our nation ethnicity, whereas sex is an activity part. Now, what are sexual disorders? Now, sexual disorders of many types. It could be because of dysfunctional symptoms. It could be because of emotional lack. And sometimes, there could not be emotional drive at all. Some people are not able to define themselves very well, what exactly they lack. Now, if you look at sexual dysfunction symptoms, so they say that here in the display, the psychogenic etiology, like people have desires, but those desires, they might not achieve them. So at that particular time, because of the physiological changes that are happening in the body, maybe their body doesn't, or the genital organs or the reproductive system doesn't cooperate during the time of the activity called sex. So at that particular time, we'd call them to be as with psychogenic etiology. Then organic etiology. Now, what is organic? That causes purely depending upon the organs, like due to substance abuse or due to any general medical condition, because prolonged use of certain medications might decrease libido. And sometimes a combination of both. Maybe it could be of psychogenic as well as organic etiology. Now, the most concerned part for us at this particular point of time is we should always remember that there are three forms of sexual disorders. The first one is called gender identity disorder, so which we see in childhood, adolescent, and adult. And then the gender that is not very specified, homosexualities. So when we talk about homosexualities, so homo is something similar, so of the same gender. Now, a girl and a girl having sexual desires for each other, it is termed to be as lesbian, whereas a boy and a boy, they're termed to be as gay. Now, if you take about unusual patterns, like no, when you don't know, uh, or sexual drives which are driven due to some other external forces. It could be by watching a movie, it could be by seeing some pornography scenes, it could be by viewing somebody, okay, or it could be because you are looking into somebody's inner wares, or it could be because you are thinking about those thoughts very frequently, or you're watching only those particular movies, you are only discussing about those topics, you're only reading about those topics, then definitely those are all termed to be as paraphilias. Now, if we talk about general identity disorders, usually, general identity. Now, somebody who is not able to identify their gender. Who are these people who cannot identify? For example, a boy or a girl, they are born normally, but by the time they achieve their adolescent period, they have different type of preferences. A boy getting dressed like a boy but prefers to sit next to a girl. So those things, though they might be transgender, they might get transformed to be a transgender in the later stages of life. So those are called as gender identity struggles or the disorders. Now, here are different types of paraphilias. Sexual desires that are aroused in an individual due to different objects dif- around us, surrounding us. Now, fetishism is about inmate objects. So, very specifically, like for example, somebody who is having what you say, a feminine innerwears. So, a male trying to look into it or just views it, just passes away, glanced at it, no, a sexual desire arouses. That is called as fetishism. Then, transvestic fetishism, cross dressing. A boy getting dressed as a girl prefers to be like a girl, whereas a girl always likes to put on boys' clothes. maybe a haircut also is done at times to show. Then sexual masochism, where people get humiliated at the time of activity called sex. Some people try to injure others, harm others, so they feel that when the opposite partner is getting damaged or injured, they feel that, yes, I'm trying to show my manly power. So that is called as masochism. Then the next one is sadism. Now, sadist, usually, when somebody tries to torture an individual, somebody who is very bad to us, don't understand our inner feelings, never let us understand or never takes concern to understand our emotion, we say they are sadist. Okay, so here sexual sadism is somebody who always tries to impose suffering on the other partner. So most of the time we view that only males try to do that suffering to the females. So that is called as sexual sadism. Then exhibitionism, somebody who is trying to show their genitalial organs or their private parts to a stranger, an unknown person. Then voyeurism, you trying to watch somebody naked, like watching pornographies, watching blue films, watching any other movie that has dirty scenes in it. So that is called as voyeurism. Then photorealism is touching or trying to rub private organs or private parts without the consent of the opposite individual. So you try to touch them or you try to rub, not you, anybody individual trying to do that, then that is called as frotteurism. So usually this happens in crowded places, especially when traveling in the bus. So when people take the transport through bus, this is what happens. So most of the victims or people who are regular passengers on traveling through bus, they come through this. Then pedophilia, aroused at the age of 13 or under. So pedophilia is somebody who is less than 13 but have sexual arousals due to different conditions, like somebody talking to them, somebody trying to show them, somebody trying to educate them. Sex education at this age is done because they have to understand that different genders or different sexes have different forms of functioning. So when we try to engage them, when we try to learn, we try to create an awareness on them. These kids at this point of time, they try to develop this sexual arousals or the sexual desires. Then, so what is the management? How do you manage an individual with sexual disorders? So the first thing is we need to take the sexual history, and believe me, 101% people don't reveal their sexual history directly to us. So we need to have somebody who is a specialist here, who can handle them, who is very good to them, a trustworthy relationship. Only then they will disclose the personal info to the therapist. Then also we need to ask their satisfaction levels. To what extent are they finding the pleasure? So how many relationships were there into? Was this only the marital relationship that they had or any other? So if any others are there, we need to identify them. We need to see the level of satisfaction, on what basis they are achieving it. Then see the patient's perception of the problem. So what exactly is the problem? Some, as I've told, they don't try to reveal it to us. Some write and show, some don't like, some show it in behavior form. Some are very open, they tell that I don't like it, I don't want it. So, obtaining sexual history is a very big task, a very tough job. It takes a lot of time for an individual to open up and to share with us. And whenever you're trying to assess them, always keep in mind the cultural background, the ethnicity, the racial, the beliefs, the food patterns, the dressing pattern. Okay, and what type of language that you are using. Okay, you need to respect all these because every individual is very important to us. So we need to identify that and we need to understand them. Always see if they are taking up any medications at the time of having sex, if preferably any medications if they are using, then we need to monitor that very closely. And who advised them? On what basis are they taking it? So that should be observed and recorded. Then any medications for any other morbidity like diabetes, hypertension, so any that will definitely have an effect on libido. Now, if you take thyroid, that will definitely decrease the libido. If you take diabetes, that also decreases the libido because of the fluctuations in their sugar levels, thyroid levels, hormones get replaced, fluctuates, the hormonal imbalances take place. So there is a chance for an individual to have decreased amount of libido or at times maybe increased amount of libido. Always try to educate. Your psychoeducation should be on the topic of sexual cycle, the concept of sexuality, what is the difference between sex and the gender. Always focus on the body image. Most of them try to focus on their body image, what outwardly we appear. So outward is something different. Inward is something we all need to understand it. So always orient them that there is a different phase for everybody in their life. A man has a different role, a female has a different role. Both of them combined together, they are binded in an institution called marriage. So we need to respect that marriage. And when it is termed to be defined by them, their marriage or their relationship, definitely both the choices should be taken into consideration. You cannot listen to one party and say, yes, they are right or they are suffering with some disorder. Both the parties should be existing to disclose or to identify the needs. Both of them problems should be identified, and always see that a counselor is addressing each and every problem of theirs. And whatever is discussed should never be opened out. It should always be anonymous and confidentiality should be maintained. Now, what in the treatment modalities? So, how do you do? What exactly do they do? So, we have various components in this. The first one goes with the behavior modification. So, it's our mental pattern or our thinking process. How you think about the opposite gender. How do you value your opposite partner? How do you give respect to the opposite person? So, your behavior is very important when you discuss or when you talk about others. Your feelings, you should also have that equal concern with the opposite person. Then, any other alternative medicines apart from our English medicine, that is allopathy, definitely we will take it into use. So, this might not cause side effects, but might help them out in relieving their stress. Then, sexual tasks. So, how frequently is the activity taking place? How frequently are they meeting each other? Meeting each other. So that preferably we try to educate them on. Then any systemic illness that they are going through, any comorbidities, definitely that has to be taken consideration of. And any medications that are interfering the libido, that has to be focused. And if necessary, we need to ask their specialist to reduce the dosage of that particular drug or for that particular comorbidity. Then both the partners should be engaged, both of them should be given education. So at times there could be pain during the sex or intercourse. So definitely pain management also should be educated to the clients as well. And even their partners also should be aware of the management. So how you can control them, how you can elevate the pain, how you can subside the pain, how you can see all the time you cannot be to a doctor and ask, you cannot knock on the door. So how to what extent you can bear, to what extent, what are the medications or any other lubricants that are available. Then the sexual physiology, the pharmacology should be made understandable in the form of sexual education. If necessary, consultations should be done. So sexual disorders, so far we have discussed. Now the next comes personality disorders. Now what is personality? How you and me approach others. We laugh all the time, we cry all the time, we are strict all the time. That defines us. So that tells our personified form of addressing others, receiving others is called our personality. So our personality is furthermore divided into, we are all classified in different forms. All of us are not the same. Okay, so we have different forms of disorders also, which are existing in the individuals. Depending upon the situations, we might be placed in any of these different classifications. But after the situations are gone, you and me could be normal. So let's look a brief look into these clusters. So personality disorders are broadly classified into three different sections as clusters: A, B, and C. Now, cluster A, we combine or we put people who have odd thinking and eccentric. They are very much focused about themselves. So those people are called as cluster A. So what are the types of personalities? Here, paranoid, who are highly suspicious in nature; schizoid, who cannot control their emotions, okay, and who always try to depend on others, always having negative form of thinking. Then schizotypal, some people who are combination of both. They have suspiciousness, they have they do not trust anybody, they cannot maintain any relationship. So that is called as schizotypal. So cluster B, they're very dramatic people and erratic people. Now, how are these people? You can see them in their actions. In these people, the first form of disorder is antisocial. Somebody who cannot adhere to the rules and regulations, who try to violate the rules, who are destructive in nature, who cause injury to the others, who are harmful in nature, harmful to the property, to the immovable materialistic things, even to the human and animals. So that is called as antisocial personality disorder. The next one is borderline personality disorder. Now, borderline is somebody who wants to be good and neither want to be proven to be bad. So they are on border. They don't want to be neither good, they don't want to be neither bad. So that is called as borderline personality disorder. So usually we see vamp, that is in the serials, people who play this role, no, they want to be good with the hero and also they play a negative role behind their backs. Okay, then the next one is histrionic personality. Histrionic, somebody who believes that they are going to create history in their lifetime. They think that, yes, I would be the person where people will look up to me. Okay, so they whatever they do, they think that it has to be recorded. It has somebody to be monitored. Okay, and they always want to be on the top, like they want people to be focusing on them and they want the others to follow them. So they feel that they are the leaders. So histrionic, they want to create a history in their lifetime. Okay, then narcissistic, somebody who's trying to impose on others. Okay, like example is Hitler. Okay, so dictatorship, they only want to pass the rule, everybody should follow it no matter what it is. Okay, so that is called narcissistic. Then the next form is cluster C. So here in cluster C, people who have lot of fear and anxiety. For very small issues, some people develop lot of anxiety, how to control their emotions. Some try to show it in the form of cry, some don't talk, some skip meals, some have hunger strike. All these categories, all these signs and symptoms are found in cluster C group of disorders. So in this cluster C, the first one is avoidant personality disorder. Avoidant, somebody who's trying to avoid difficulties. For example, an individual who failed in an exam is scared to attempt for the second time, or is scared to go in front of the teacher, or a teacher who is very strict enough or might be monitoring the student continuously. The day that teacher is absent, it's a full joyful day for the students. So you feel that a teacher is avoiding you, or you are avoiding a teacher. You're not coming in contact with that particular teacher. Then definitely severe form of anxiety is existing in the individual. The next one is dependent personality disorder. Somebody who is always dependent on others for even small, simple activities in daily living. It could be writing, it could be bathing, it could be activities of daily living also. They're highly dependent. Okay, then next one is OCD. So OCD could be of various types. Usually, no, we talk a good example. We say that repeated hand washing. Okay. Apart from this, having obsessive thinking about sexual activities, obsessive thinking about cleaning, obsessive thinking about your dressing, obsessive thinking about viewing cinemas, how to enjoy, obsessive worried, or you are very worried about your exam result. Okay, so these obsessiveness, definitely you will put it into compulsion. That is, your behavior will show us that yes, you are restless. So these are the different types of personality disorders. Now, if you look into here, the slide, there are different forms of people engaging in different activities. So any individual who has symptoms of personality disorder, all of us definitely at a given point of time or in our daily time, we might be having some of the clinical manifestations with us. Depending upon our situations, maybe we act like that. Sometimes, they are our inborn characteristics. So we cannot avoid them. So if you feel, or I feel, anybody feels like that, then these are the different ways for us to cope up with, which we can use in our day-to-day life so that we don't land up in having personality disorders. So psychoeducation, always don't think that education is somebody only giving us an health talk. You yourself can get educated. Your very own self get motivated to learn, and you yourself feed your brain with good thoughts. Then your very own care, maybe doing it yoga or exercise, or your very own diet. Then substance abuse. So don't get involved or indulged in any substance use. Definitely that will help you out in having a good personality. Then avail relaxation and management techniques. So how well are we managing our stress? That's a very big task for all of us in our day-to-day life. Now, 6 days a week we work. The seventh day, the Sunday, we become a spoiled brat. And Monday, again we try to cook up. Monday mornings are really lazy for all of us to get back onto work. So that Sunday, how well you are relaxing. That Sunday, how well you are trying to relieve your stress. That management we all need to develop. You as students and we as teachers, every individual on planet Earth definitely deserves 1 day break to manage and to cope up with stress. The next one is our hobbies. Each one of us are gifted with hobbies, our interests. We have different multiple dimensions of exhibiting our hobbies. But the sad part is we don't give time for our hobbies. We only give time nowadays viewing the mobile phones. The best part is nowadays we chat, we talk over the phone, we play over the phone, or either we sleep. So this is how we are not giving time to our healthy hobbies. So whatever interest that we are in, whether it is gardening, whether it is stitching, tailoring, cooking, whatever it is. So try different means to engage your time so that you will be active. Next, communicate, always share with your loved ones how your feelings are, your thought process. See, definitely at home, one or the other, somebody will be definitely close to us. If mother or father is not close to us, then our good friend next to us will definitely help us in communicating. So that we always should have for our lifetime one good friend to communicate at any given time, whether we grow old or whether we are young. Communication is very essential for all of us. Then quality time with loved ones. So most of the time, our quality time we spend on our mobile phones. Now, stop putting the mobile phones aside. Sit with group of your friends or your batchmates, your seniors or your juniors. Have a laugh, crack jokes, discuss the subject, discuss something else that is very interesting. Okay, so how well you exhibit a particular topic, how well you're coordinating with others. You want to learn something, so discuss with those eminent people or good people who can teach you those particular techniques or that particular subject. So do that. Then join a support group. So it's hard to find a group like that. We have to pick people, we have to create a group, and we have to see that our group members are active. always see that you are disciplined in maintaining the therapy. So any medications that the doctor has given you or has told you to stop, we need to follow that. Most of the time, be depending upon our own categories, depending upon our symptoms, we ourselves start taking tablets. A small pain, a painkiller, an analgesic is consumed. So that should not be a hobby to all of us. Then, now here are different types of disorders that we have discussed. So, paranoid is mistrust, schizoid, somebody who's not forming the relationship, schizotypal. Okay, so antisocial, somebody who doesn't follow the rules, regulations. Borderline, the example is vamp, a villain in a cinema. Then histrionic, somebody very, very want to create an history. So they always want to be top. They want to be viewed by everybody. They want to be the best example to everybody. So some, when they're not getting attention, they want to do that. So attention seeking behavior is histrionic. Narcissistic, they don't admire anybody. They want everybody to follow them. The great example is Hitler. Then avoidant, those who do not perceive others at all. They don't understand other feelings. They never show concern. So dependent, very, very submissive, depending always, depressive. So they might be having fluctuations of depressions. Then passive aggressive, so pattern of negative attitudes and passive resistance to their very own body. So these are the different types of personality disorders. Now, how do we diagnose them? So we diagnose them through a different means of test, which is called as toxicology screen test. Now, in the form of personality disorders, we need to look out whether they are affected with any other sexually transmitted diseases or any other comorbidity or any other form of disorder or any disease that is crippling them. Like, see, if you see chronic diseases, cancer. So because of that cancer, there could be change in their personality. They might not be always having positive thinking pattern. They might develop negative pattern that, we cannot give a guarantee to certain amount of diseases. So definitely the comorbidities also play a vital role. So when we try to diagnose them, we also need to look up at their comorbidities or any other chronic illness that is trying to make them crippled. Okay, then. So CT scan, which will help us to rule out if there is any organic chemistry or organic causes involved, then definitely a radiography. So an X-ray, radiography is means X-ray. So if any injury to any part of the body necessary to rule out, then we go with it. Then caregivers. So how is the management part? How do we really care of them? So caregivers should be on alert. They should always be taught on what basis how you can treat them. Now, personality disorders people, they cannot react like you and me. They are different in their reactions. So it's hard that when caregivers are changing or there is a role played by the caregiver, definitely that individual only has to be assisting them. Now, a new person becomes a caregiver, it's very tough for them to adjust to understand the psychopathology of this particular disorder. Now, the next form is psychotherapy in the modality. So, psychotherapy is discussing about the forms of their emotions, or maybe you can discuss here the talk therapy. Psychotherapy is nothing but talk therapy, where the individual or the victim or the patient tells us their thought process, their signs and symptoms, how are they feeling it, how are they doing it, and what stops them to be from being normal. So in the psychotherapy, the therapist also from their end tells them how to cope up with that. If any medications are required, they will tell. So if any social stresses, environmental stresses are involved, that also will be focused on. So now inpatient care, at times people get admitted also. So how do we care for them? So very recently we had one inpatient patient who was being admitted with avoidant personality disorder. So the greater example in her life, what went wrong was during the time of COVID, she lost her husband as well as her kids. So after that, she believes that marriage has no value at all. She's all left all alone in the world. So all her loved ones were close by only during that period of time. And COVID was something very, what you say, we were all there for each other, but we were not able to view each other very closely because we all had to be in lockdown. We were asked to maintain distance, isolation, and all that, right? Quarantine was there. So she feels that, after even COVID has passed by, she even feels that. So that avoidant personality disorder she has developed. So they brought her to the hospital, and, she believes very strongly that, marriage is of no use in spite of counseling, in spite of advising her, telling her that life is not the same for everybody. She says, can you give a guarantee in a marriage? Can you give a can you certify that these individuals will have their silver jubilee, this golden jubilee? So those questions she tries to impose on us. So we cannot give a guarantee to anybody's life. Our life and death is in God's hand. So she developed the chronic phase of avoidant personality disorder. So to manage her at times is very difficult, but otherwise, slow and slow, she has learned that her life was like this. She has to live single. She doesn't want to get remarried again. So she is continuing her life. It took a lot of time for her to understand that she is single. And slow and slow, she started moving up with her family members. And very slow, she took up even her job. Okay, then transfers. So some patients are hospitalized for very due short-term notice period. So if required, we refer them to a bigger hospital or a district hospital or an institute where they can stay for until the doctor advises or maybe until they are cured under the observation. So what are the interventions? As nurse, how do we control them? How we can have a better means to approach these individuals? Now, personality disorder is something, you know, just looking at people, if they are harsh, we say, oh, she's very strict. Oh, she's very this thing. Somebody who talks, we say she's very talkative. So when we know like this, we ourselves, we classify people like this. So how we manage them? We cannot escape from all in our lifetime. We have to be with them. We have to understand them. So, how well are we going to manage in our day to day lives? So, first thing is always accept the individual as they are. Second thing, see that you give them a safe environment. So you don't cause triggers, don't promote them, don't provoke them, don't give them those scenarios, don't talk to them that tries to what you say, try to provoke their anger, try to increase their frustration. So you see that the environment is good, safe, physically and psychologically. Then set a limit. So whatever they do, a time limit should be there. They're trying to do good. Maybe you have seen that goodness in them. You appreciate it by saying, very good, good job. So you will have to pat it back at times. You will have to give a shake hand. Maybe you will have to smile at them. So a positive reinforcement will definitely help an individual to cope up. Then communicate the manipulative behavior. So here comes the task. How you can make them understand their very own behavior. Most of them, we all feel that we are right in our very own means. Nobody can say, and no individual accepts that I am wrong. So to make them understand where they are deviating, where they are hurting others, where they are trying to harm themselves or cause harm to the others, that manipulative behavior, that behavior which is not socially accepted, should be understandable, should be made clear to the individual. Now, when you have made them understand, always see that you engage them in the different activities in the ward. So maybe trying to engage others with talk, trying to help the sister in giving medications, trying to help the doctor by introducing every day the doctor to the patients. Okay, so irrespective of the doctor or maybe that unit, whichever they belong to, some people come, they become proactive. They come forward whenever they see a doctor, they go and say, "Hi, doctor, good morning, good afternoon. Your patient is on bed number six." Now, that is something which is voluntarily they are doing it. So, that kind of unit activities we really need to encourage, and we have to tell them that it's a good sign. Somebody who cannot do this maybe might learn by seeing this. Then always approach from front to avoid misinterpretations. So never place behind. That is, most of the time when we don't like people, when we are hurt by people, we don't tell it on their face. We always talk on their back. So here the meaning says always look into the eyes of the client, face the client, and then talk to them. So, how well you are trying to make them understand, how well you're explaining them so that you avoid misunderstandings. At times, when there is an interference, when there is a misunderstanding between a nurse and a patient, a third party comes and involves there, trying to prove that, yes, I will calm down. So, sometimes, instead of calming down, there could be chances that these individuals might depart from each other more. So instead of third party coming into existence, it's better that a nurse and a patient only comes, face each other and understand each other. So that even suspiciousness also can be reduced. And always see that behavior patterns are interrupted. So how the behavior is getting interrupted. Now suppose they are using a wrong behavior, or maybe they are approaching you in a negative way. Interrupt it. Say stop. It's enough. Let's move on to another technique. Let's take up another break. Okay, so that's how you will interrupt when they are not in a normal behavior pattern. And if they are following a very good pattern of behavior, they are were trying to execute themselves. Definitely, you should not pause an interruption there. You see that it is being continued. Then identify the triggers. So the trigger could be anything. It could be their personal info, like for example, who had a love failure. Okay, they might feel, a boy might feel that all girls are the same. A girl might feel that all men are the same, all boys are the same. A female, a woman, or a married woman who maybe she's dissed by her husband. She maybe the husband has cheated her. So in her context, she might feel that all men are the same. So here, if those triggers are existing, you always talk about marriage, you always talk about the gender, you always talk about their relationship. Definitely, that particular trigger, that particular event will trigger more. So it's better we don't talk about those emotions or that particular relationships, or those scenarios should never be created or even discussed also. Then always see for manipulative behavior and non-acceptable behavior. So you will have to be alert. So how can you be alert? So you will have to be a vigilant type, like an eagle, all the time monitoring them. If in case we are not available, make ensure that their attendants let us know where was the manipulative behavior done. So if they notify us, immediately we will have to set an limit to that. We will alert them and see that an alternative pattern is also done. See, when we get angry, we try to show it, we project it on others. Yes. So all the time, anger cannot be projected on just one person, right? So you will have to do it in different means. At times, we have to be calm. At times, you can scribble, scramble. Sometimes, we shout. Okay. So how alternatively, how you are trying to control your anger? So that alternative methods also should be discussed. Then medication compliance. Most of the individuals do not follow this. They don't adhere to the medication. They don't take it on continuity basis. They stop in between. So that continuity, that lab should not be existing. Then psychoeducation on decision making skills, measures to cope up with disordered behavior. So our psychoeducation is very, very important. See, whenever we talk about psychoeducation, most of the time, our topics are very limited topics. But at times, we will have to create topics for our own self and discuss, like, family bonding system, problem solving techniques, alternative patterns of stopping the negative attitudes, how well you're trying to show different forms of disordered behavior, maybe different forms of communication techniques, when, where, how to stop them. Instead of using bad phrases, how good phrases can be formulated. So these also could be few topics of psychoeducation. And always see that the patient participates in the unit management, and whenever they are participating in the routines of the ward, always make sure that you supervise them with a vigilant eye. They don't so that they don't get deviated from the regular policies of the hospital. Then always see that if they have suicidal ideations, it's very hard to assess at times, because all of them don't disclose us their behavior, their understandingness, their way of dressing, their thought process. It's hard to read somebody's heart and mind. So, to assess personality disorders is not that easy as we discussed. It takes time, it takes a lot of patience, it needs a lot of courage also to open up to an individual and say, this is what is lacking in you, this is where you are falling a negative, there is a negative remark, let's embark on a good journey. So to promise them to stop that negative thinking and to move on for a positive life for their lifetime is a challenge. Suicidal ideations are a big concern because personality disorder people easily land up in having depression. And when depression is not assessed, is not looked into, not taken care of, not identified, definitely ideas start evolving in the patient. Some people always have ideas but never do execution. Some never think of, but they do the execution. So it's hard to identify. The only thing that we can hope for people with personality disorders is our better love, our affection, our warmth, our communication. These four things, if we do, it's better way that we can really manage them. Always encourage them to have a diary. Most of them in the earlier days, you have the habit of maintaining a diary. Nowadays, because of our busy schedules, we're not doing it. But encourage the personality disorder people to have a diary for themselves. Even sexual disorders also, because they cannot talk, they cannot reveal what is going through in their life. Maybe if they can record, that would maybe their closed ones can just read and might come to know what is the real problem in their life. Then always use the time option. So when they are deviating from the goal, or when they are not directed towards a particular goal, then you will have to say, stop, time out. It's high time. Give it up. Give up. So these phrases we have to use so that we confine them to a particular behavior which is acceptable to the society. Observe and intervene for escalation changes. So, escalation is any changes in their behavior. So, sometimes, escalation techniques could be very different forms. Now, like for example, somebody who is always sad might turn out to be happy. Now, what is that change in them? So, what made that difference? So, what technique has been used? Maybe somebody trying to crack jokes all the time. Somebody has shared a joke book with them. Somebody has given them an activity to get engaged with, get busy with. So, what exactly are these changes? How are you doing that? Making use of a newspaper or a bulletin paper? Maybe you're giving them a hand notes, a handout, you're giving them something to draw, paint something, or whatever is their imagination you're trying to write article like that. So what how best are your escalation techniques in coordinating the behavior of an individual? So this is about the interventions that we need to plan about for personality disorders. So before we wind up, let's have a gist of what we have discussed today. So, in the sexuality disorders, we have discussed that there are three main different disorders. The first one is somebody who is having sexual desires. So, this desires could be of organic causes or psychogenic causes. The second one is somebody who is having dysfunctional, that is organic causes, because any changes in their reproductive system tract. Then the third one is gender identity disorders, which is also, and otherwise, the other form is paraphilias. So, very specifically, due to certain objects in the environment, if they're getting used to them, then we call them as paraphilias. We have discussed about various paraphilias so far. Then, so the management for paraphilias are, even for the sexual disorders, we have seen the comprehensive treatment plan. You go with psychoeducation, we go with the party, that is psychoeducation for the partner as well as the individual. We try to go with medication. If any comorbidity is existing within the client, that comorbidity medication, any medications to be disclosed or to be stopped, to be monitored, that we have to discuss with. And then if there is, we have to respect the individual, discuss along with them. So this is how you will manage the sexual disorders. Then the next part is about personality disorders. So personality disorders are of divided in three types: cluster A, B, and C. Remember, cluster A is people who are egocentric, eccentric, they are only for themselves. So in that we have discussed paranoid, schizoid, and schizotypal. Now, B, cluster B is people who are dramatic, erratic, who want to be noticed by others. Like, for example, we have discussed about narcissist personality as Hitler, then avoidant personality disorder, sorry, then we have a histrionic personality disorder, attention space seeking behavior. Okay, then we have different forms of behavioral patterns. Then coming to the third one, in cluster C, so here we have avoidant personality disorder as well. Now, when we talk about this, now moving on to the other slides, something that is very important to all of us is in cluster C, always remember anxiety and fear is our basic part. So somebody who tries to avoid sickness, somebody who's trying to avoid people who are strict enough. So OCD, avoidant personality disorder, dependent personality disorder comes under cluster C. So now how are these personality disorders identified? We go with thorough history examination, we go with different CT scanning, radiography if necessary. Then caregivers will let us know how well they are dealing with. So the treatment modalities include psychotherapy, patient care, and transfer from one hospital to a bigger unit or a better hospital. So in the interventions, we have discussed that accept them as they are, provide time out and let them know where they have to stop and where they have to go on or move forward. Whenever they have exhibited a good behavior, give a positive reinforcement. Always try to confront them or tell them from front onwards. Don't always be on their behind. They should not listen to your corrections from somebody else. It is you who are going to correct them. So you will have to face them and tell them. And always see that you avoid triggers in their environment. Don't discuss about those things. Don't allow them to stay in those environments. See that you give them safe environment and always see that they follow the medication on time. Assess for suicidal ideations and see that your psychoeducation topics involves about various things like problem solving techniques, different phrases to open up, or maybe you can talk about family bonding system, you can talk about solving techniques, you can talk about alternative measures to cope up with anger, to cope up with any difficulty that they are facing. So these are the different patterns or the different nursing interventions that we need to look up to.